Dr. Manjunath ji. Dr. Manjunath ji.
Yes. My respects to the Honorable Speaker for this opportunity to debate on budget as well as demand on health sector. And I'm very thankful to the people of my constituency for putting me here in this heart of democracy. Finance Minister Srimati Nirmala Sitharaman has put up her budget. The financial balance sheet of Union budget is healthy. Unfortunately, the genetic balance sheet and the health balance sheet of Indians is not that healthy. Young and middle-aged Indians are becoming vulnerable to various non-communicable diseases. Today, 60% of deaths in India is due to non-communicable diseases, and number one killer is heart attack and its cardiovascular related disease. And most important, this particular heart attack is occurring among younger people. In fact, earlier, children used to bring parents for the treatment of heart attack and its various cardiovascular disease. Today, parents are bringing their children in the age group of 25 to 45 for the treatment of heart attack as well as brain stroke. So this is where, to address this very important issue, our Honorable Prime Minister Narendra Modi ji has brought in one of the biggest public health scheme in the name of Ayushman Bharat. So today, otherwise for all these problems, our poor people were selling jewelry and they were selling lands. In fact, the treatment is so expensive in private corporate hospital, and what they spend in corporate hospital is their lifetime earning. To address this issue, the Ayushman Bharat is in place ever since 2018, September 23rd, and till now we have treated under the scheme more than 6 lakh crore beneficiaries have been treated, and 65% of the population, at least 65 crores have been benefited. They are the Ayushman Bharat beneficiary. Why I am stressing this heart attack issue? Because heart attack today is no more a disease of elite class, is no more a disease of rich people. It is equally increasing among poor people, farmers, villagers, laborers, and even underprivileged. And the treatment of heart attack is time-driven. For every 30 minutes of delay in initiating treatment for heart attack, risk of death increases by 7%. So this is where time has come. We have to adopt what is called hub and spoke model for treating heart attack. The spoke hospitals has to be taluk hospitals, and hub hospital has to be the tertiary care hospital in nearby bigger cities. So initial treatment has to be given in taluk hospital under spoke and hub model. We have what is called one minute injection of clot dissolving drug. If that medicine, a simple injection in an ordinary MBBS doctor can do with little bit of awareness, if it is given within the first 3 to 6 hours of heart attack, risk of death comes down by 20% to 5%. And otherwise, what is happening today in semi-urban and rural areas, heart attack patients and stroke, they are traveling hundreds of kilometers to bigger cities, thereby precious time is lost. So, as a result, today Ayushman Bharat covers all these expenses. So, I was part of this hub and spoke model of heart attack treatment in our state of Karnataka. We have implemented in 45 taluks. Now it is being expanded to 90 taluks. It is in place in some other states also, like Tamil Nadu, Goa, Maharashtra, Orissa. So, India should adopt this spoke and hub model of treating heart attack patients across the country, so that the patient with heart attack should get heart attack treatment at the doorstep in Taluk Hospital within that golden hour. If that treatment is given after 12 hours, now the model how it works, initial treatment is given at this peripheral rural hospital, and the injection is given, which cost about 18,000 rupees. It is covered under the scheme, and with usage, as usage goes up, it would be available even for a lesser cost. Then after 3 to 6 hours of giving this injection, they are shifted to nearby bigger places where angioplasty and stent procedures are available. So this, because the economic impact of this life loss due to heart attack and brain stroke, the Harvard School of Public Health Policy and also World Economic Forum has estimated over a period of next 13 years, if the same trend continues, probably the economic loss for the country will be almost around $2.17 trillion. To that extent, it can happen. And hub-and-spoke model is another thing. The stent that was used for fixing the blockage of the arteries of the heart, which was costing 70 to 80,000 rupees earlier, due to the intervention by Honorable Prime Minister and the Health Minister, now the cost of the stent has been reduced from 80,000 to 25,000, which is a great boon to the poor patients of India across all states. Another important thing is, we are talking about this Janaushadhi Kendra, which as my honorable other members have already talked, because there are 10 crore diabetics in India. Another 10 crores are on the verge of becoming diabetic, and it's a lifelong medication. As a result, Honorable Prime Minister has opened nearly 12,000 Janaushadhi Kendra, which is going to be of a great help. So there was a criticism about Ayushman Bharat. The package rates are not that very remunerative. As a result, private hospitals are not getting empaneled. But the latest package revision that occurred in 2022 has given a very decent package rate. Now probably, and another important thing, the health subject, medical education subject is also a state subject. So now what is happening, the time has come, we have to strengthen the existing hospitals. We have to strengthen the existing medical colleges with manpower, technicians, and staff nurses. That is where we are lacking. So theme should be we are only talking about construction of hospital, construction of medical colleges, construction of AIIMS. The theme should move from construction to creation of post. From creation of post, we should move on to recruitment. So that will put up, because India has got a great talent pool. Today we have close to 14 lakh allopathic doctors and 5 lakh we have Ayush doctors. Our target is just another 3 lakh doctors are required. In the last 10 years, there is an exponential increase in the number of medical colleges. My hearty congratulations to our Honorable Prime Minister and the Honorable Health Ministry, because today there are 386 government colleges and 326. But most importantly, yes, we are going to reach this number, strategic number, in about 2 years. But most important, I have a strong feeling. My suggestion would be, yes, we should have more medical colleges, but number of seats should not exceed 150. Number of seats should not exceed 150, because in many medical colleges today, there are more medical students than the patients. As a result, they are not getting a hands-on experience. Undercooked and under-trained doctors are more harmful than the disease. That is one thing. Another important thing, the medical college recruitment is purely a state subject. So that is where the state has to put a lot of their interest in, because Government of India is giving grants toward the construction, and recruitment is purely a state responsibility in medical colleges apart from our central institutions. That is very, very important. Another way of because today India, every year we are admitting 107,000 MBBS seats, which was just 40,000 about 10 years ago. Then we have 75,000 postgraduate seats, which was just about 30,000 10 years ago. There is a phenomenal increase in the number of seats, both MD as well as MS seats. But now, many district hospitals, we have a bed strength of 200. So I think we have to be innovative in this way. Rather than starting a conventional, traditional medical college, in these 200-bedded district hospital, we can start a postgraduate medical college. That means no MBBS. It's only we are training MDMS because faculty requirement is small, our initial expenditure is small, and at the same time, patient gets a better care and common man gets a very good care. That is one of the important things. So, yes, cancer, Honorable Finance Minister has waived off the custom tax and couple of cancer drugs. My suggestion would be better to include, because cervical cancer is third common cancer, this vaccine should be part of our immunization program. All our high school girls should be vaccinated because this vaccine can bring down the incidence of cancer by 90%. So that is one of the biggest advantage. Then, yes, we always, today, under Ayushman Bharat scheme, organ transplantations are done, which was never dreamt by a common man. You can have a liver transplantation, we can have a heart transplantation, bone marrow transplantation. So probably we have to create awareness among the common man that these things are available under Ayushman Bharat in our own scheme. This is one of the important thing I wanted to tell. Say, another important thing is going back to vaccine, COVID-19. See, COVID-19 menace, that pandemic, the way our Honorable Prime Minister handled, we really salute his leadership, and he became the chief warrior of COVID-20 management. Because although we imported this virus from China, the WHO has gone on the record. The way India has managed COVID pandemic is really exemplary, and 200 crore plus vaccines were given free of cost. Had it not been given, we don't know how many of us were here, or to be here or not. That is one of the greatest service the Honorable Prime Minister leadership has done to this place. So another, yes, we have to adopt artificial intelligence and machine learning in those areas where specialists are not available, where the specialty tertiary care is not available. Certainly we can invoke and adopt artificial intelligence. Today, 13% of deaths in India is due to road traffic accidents, bigger than cancer deaths. So there is a need to have a polytrauma center, because 90% of these patients, accident victims, will have multiple injuries, head, abdomen, and fractures. They all need to be fixed under one roof. Again, treatment need to be given in golden hour. And probably for every 125 or 150 kilometer of national highway, there is a need to establish a small polytrauma clinic, not a big hospital, where at least initial treatment can be delivered during this golden hour. This is one of the biggest this thing can happen.
Thank you, sir. Thank you, doctor.
And yes, sir.
Thank you, doctor. Thank you.
Just I will take 1 minute. There are 2 states that have been left out for establishing games. Karnataka is one of the states, and probably hope Finance Minister and Honorable Home Minister will consider granting 1 AIMS to Karnataka state. That will be it's a long pending desire of people of the state. That is one thing. Under National Health Mission, yes, we are appointing with the funding from National Health Mission, we are appointing staff nurses and doctors on contractual basis. Their salary need to be increased, because the present salary, what they are getting, a staff nurse is getting 13,000, which is less than the Daily Wages Act actually, and a doctor is getting only 50,000 on contract basis. This is one of the reasons there are no dearth of doctors in India at this time, but there is maldistribution of doctors. More doctors are in cities, less in villages. So we have to increase their salary.